Hello everyone and welcome to this ANROWS webinar on the prevention of violence against women and safer pathways to services for culturally and linguistically diverse communities. My name is Maria Collis and I'm the project lead at ANROWS for our culturally and linguistically diverse Projects with Action Research initiative. Before we begin this webinar today, I'd like to acknowledge that I'm calling through to you from the lands of the Darug people. I'd also like to acknowledge the elders, past, present and emerging, from all the Aboriginal and Torres Strait Islander lands you're joining us from today, and to recognise that their sovereignty was never ceded. I'd also like to recognise at this time the impact that the COVID-19 pandemic is having on communities across the country. We know that it's having an impact on people's access to family violence services, and we also know that it's disproportionately impacting those on temporary visas and those with a precarious visa status. Our thoughts are very much with those affected. It's particularly at a time like this that we really value this opportunity to come together with you and share some of the work that we've been doing. So let me tell you a little bit about the initiative. So the ANROWS CALD PAR initiative is funded by the Australian Government Department of Social Services. It involves 26 projects from across the country working on family violence with CALD communities. 18 of those projects focused on prevention, and 8 of those projects focused on creating safer pathways to crisis and support services. ANROWS was contracted to support these projects to take an action research approach to evaluating their activities. From all the project's action research, as well as our own support notes and evaluation surveys, we've published an Insights for Practice report. This report contains 10 key insights for practitioners and policymakers. Although we've dealt with limited data and it's not representative of all the work in this area, it does present some important directions for intersectional, collaborative, and critically reflexive work with CALD communities. In today's webinar, we'll be focusing on 3 main areas of insights. These are strengths-based community engagement, working with CALD men as allies in prevention, and capacity building in cultural safety. I'll be joined today by 3 wonderful project leaders from the CALD PAR initiative, and we'll also have videos from 3 project teams during the webinar. So let me introduce you to our panel of 3 project leaders from the CALD PAR initiative. Firstly, we have Seblewerk Tardasa, the Director of SAP's Community Hub in Queensland. Seble, can you tell us a little bit about the work that your project has been doing in prevention in the CALD PAR initiative?
Thank you, Maria. Our project was being funded by Department of Social Service to prevent domestic violence for 6 African community groups. But we managed to deliver our project beyond those focusing groups. And with the help of community leaders gathering and Multicultural Australia, we managed to deliver the project to Middle East and Southeast Asian community group, and including other African community group. Through our project, we have been raising community awareness using community conversation as a tool, and community conversation guide as communities to use. And our other focus was to facilitate a peer support group for men using their interest and hobby. And after we just also using their interest and to develop community and service educational resource by partnering with other agencies. We also deliver forums annually with a partner organization to the community group after we collect our community conversation. Through our community conversation, we collect data and issues, and also understanding of communities' attitude in domestic family violence. And we use those community conversation resource to address further findings and gaps in the community and the service.
Thank you so much, Seble. And we'll be hearing more about your work around Men's Shed and the Men Managing Change program as well during the webinar. We're now going to move to Catherine Adey, the Prevention of Violence Against Women team leader at Multicultural Centre for Women's Health in Victoria. Catherine, hi. Can you tell us a little bit about the work you've been doing?
Hi, Maria. So Making the Link, it's part of the Safer Pathways stream of the CALD PAR initiative, and it's a collaborative project working with migrant women living in regional Victoria to link them to mainstream family violence and other relevant services in regional areas. And those areas are Ballarat, Bendigo, Mildura, Swan Hill, and Geelong. And we achieve this by building capacity on both sides. So that means delivering education sessions in English and in language to encourage migrant women and men to reflect on their well-being in relation to gender equality, and also to discuss and reflect on gender and race-based discrimination and family violence, and to provide support and information on where to seek help locally. At the same time, we support a range of services from response to prevention of violence to understand and address barriers that are experienced by migrant women in regional areas. So I'll get into more later, but for example, this could include visa uncertainty, which Maria already talked about, a fear of being stigmatized by people in the community and also by mainstream services about people's cultural background. And all of this is obviously compounded by remoteness and social isolation in regional areas.
Thank you, Catherine. And now we'll go to Dipti Zachariah, the Multicultural Health Team Leader at Western Sydney Local Health District. Dipti, can you tell us a little bit about your project?
Thanks, Maria. Our project was titled Rich Culture Should Have Rich Relationships, and it was a partnership model between Multicultural Health Services at the local health district and the Punjabi community's Harman Foundation and two community partners from the Sudanese community's Nuba Mountain Group and the Spiritual Reevaluation Group. So the major aim of the project was for the communities to develop a conceptual understanding and recognition of domestic violence within the context of culture, gender, generational differences, and social changes, build the community's capacity in planning development of appropriate community-driven DV awareness and prevention initiatives, and develop culturally appropriate resources in partnership with the communities at a grassroots level. The project started early in February 2018, and we're still going through it. And it enabled us to actually not only develop conceptual understanding of the communities, but help them design and own the interventions to make it much more sustainable once this project closes. Thanks, Maria.
Thank you, Dipti. And we'll be hearing more from all of our presenters throughout the webinar today. So now we'll move to our first set of insights for the webinar. Some of our most important findings in this initiative were around strengths-based community engagement. The insights for practice that we've drawn out in this area in our report are to invest time in building culturally safe and trusting relationships with diverse groups and leaders in communities, and also to support CALD communities through strengths-based and aspirational language around gender equality and violence prevention. Now we'll see a little bit about how this works in practice. We have a video contribution from the team at Relationships Australia, South Australia, on their Good Life project. A reminder to submit your questions as the video plays.
Our DV prevention program started 2 years ago, funded by the Commonwealth. After receiving funding from the government, we immediately established a panel, selection panel, which had a representation from the community as well as management here at Relationships Australia. And 2 part-time workers were employed, a total of only 3 days, but we had to capitalize on the knowledge of other African workers within Relationships Australia and outside Relationships Australia. And with their help, we established an advisory committee with 80% of its members were of African background. And between all the networks, the workers and the advisory committee, we built lots and lots of networks and connections with different communities, African communities, who helped us access the community and started facilitating conversation at management level as well as at the community and different networks that included churches, mosques, wherever we could get in, we basically went in.
if we were to have gone into the community and talk about, oh, we have a session on family and domestic violence, the level of engagement would have received would have been different, because we know this from experience in working with other taboo topics, that putting a negative spin or naming it directly when people are not ready becomes a barrier. But the strategy with this project is to look from a point of view of what people really connect with, and in terms of engaging and consulting with the community to come up with their understanding of the issue and how they wish to engage with it, and they came up with the name Good Life. Good life in the sense that everyone recognized that for them to leave their countries to come to Australia, they had the intention of coming to have a good life. But then the issue becomes, when they come in Australia, so many things come up, maybe unemployment, lack of understanding of the system, issues with relationship, parenting, and so many other things then come in the way, and then conflict arises. And if people don't know how to manage these things or how to seek for help, it then sort of escalates into family and domestic violence.
When we go into a community, we know, like that community A or B, this is the issue, this is the understanding, and these are the barriers.
I didn't know much about domestic violence, especially from the African young people's point of view. This project provided me that opportunity to engage with young people like myself. I feel really confident. I can talk about the domestic violence in a way that it does not really stigmatize it.
I mean, this program is much needed. I mean, there's an element of taboo that's attached to it. It has opened a new platform where people can come and start to have these really important but quite sensitive discussions. And we've seen some breakthroughs, because once you start to articulate your feelings really better, and your problem-solving skills just automatically improves. But my biggest fear is initiatives like this that are unique and quite empowering, if there's no kind of an element of sustainability in it, that like becomes intergenerational, we kind of lose the whole kind of long-term impact aspect of it.
As a woman, I know that I'll have daughters, I have nieces, I have sisters, I have friends, and having these conversations not only destigmatizes DV as a topic, it also makes it easier for us to talk about it as women when we come together. And also when I see myself having conversations, I've personally gone through or seen or experienced domestic violence in the flesh, so I understand that when it's not talked about or it is a taboo topic, I understand how that can be damaging to families and the youth as well.
One good thing about the program actually was the fact that we are not told what to do or how to say things. We are given that opportunity to express ourselves, what we think about domestic violence. And this is something that sometimes gets missed in the whole picture, because sometimes men from African background, we feel like people have this feeling that we are the perpetrators all the time, and so there's this negative connotation to it. So when you say domestic violence, people don't want to talk about it.
The project has achieved so much, and I wish I had more time to go through them all. In a very nutshell, I could say that all the promotional materials that we've developed are still being used. The poster is being used actually as a tool to help the conversation, whether we're working with individual or family or a community. We've held so many conversation sessions with the community, and we've learned so much, and we've developed basically a lot of information about understanding about the cultural context. We've run cross-cultural training also to help service providers understand the context of DV within African community. We have built a huge network. We have confidently, we could say, more than 2,000 people benefited from the program with so little funding. There is a huge movement from the youth community, African, to keep the conversation happening. And we've developed also videos to help our community also continue the conversation.
So thank you, Raza, for that video example of taking a whole-of-community approach to prevention, using aspirational language around achieving the good life for families, and gradually allowing family violence to be discussed in the context of settlement. Dipti, I know that your project took a related approach with two different communities. How long did it take you to build trust with those communities?
See, initially when we started, both communities were happy to come on board, but it took us almost, I would say, 6 to 8 months to slowly start building trust and allowing communities to actually get us into their space. So that was the initial trust building, and it easily took us a year for them to, I would say, completely trust us and disclose or even come on board as a partner where they felt respected and valued in the engagement.
Right, and how important was responding to their different settlement journeys when building that trust?
As I mentioned when I started, we had two different communities, the Punjabi community on one end of the spectrum, and on the other side you had the South Sudanese community with a refugee background. They were at different levels of engagement with different challenges. And as the practitioners and people on the project team, it was important for us not to stereotype and label, but appreciate that their challenges are different and where they are at that moment is important. So we had to understand whether it was, there was post-traumatic stress involved, where there were other cultural issues that one community had more than the other, whether their styles of parenting was different, the patriarchal lenses through which they saw life was different, and understand that with them alongside, and then approach the issue. So they had different challenges. For example, with the Punjabi community, right from the beginning, they spoke a lot about challenges around gender equality. And for the Sudanese community, it manifested through intergenerational conflict. So this started from the beginning, and we had to approach it using what they saw as the issue, and then slowly bringing in other challenges that might come through. And with a lot of these communities, for example, the Punjabi communities, you had settlement issues because you had women who came on dependent visas. They came with their partners or husband. With the Sudanese community, you had settlement, even though you had defined settlement time, say for 5 years. In 5 years, refugee communities should be settled and functioning and ready to conquer the world. Many of them fell through the gap. So we had to address those issues and connect them to services that would support them to ensure they're fine and in a safe place to go ahead with the focus on domestic violence and family violence prevention.
And how is this approach that you took different to community consultation as it's usually done in mainstream organizations?
See, many times, I think from a mainstream perspective, there is a tendency, you have a fixed program, you have a fixed design that has worked with majority of the community, so there's an assumption made that one size fits all. And maybe service providers, however good their intentions are, they might not have enough time to actually unpack it with the community and address issues that might arise as we go along. So I think with the project in consultation with the ANROWS team, we consciously made an effort to invest in that trust-building relationship and not ignore issues and challenges that kept coming up, because you could brush it away and say, we're focusing on domestic violence prevention, we're focusing on designing of interventions, and ignore the rest. We couldn't separate the two. So I think time is a factor, and understanding that tailoring and customizing and allowing communities to own the intervention is important if it has to be successful and it has to work.
Thanks, Dipti. And now we do have a question from the audience on this area. This question is, how are you getting the message across about domestic violence, especially in this pandemic period where COVID-19 has forced people to stay at home? Now, Dipti, I know that your project was quite innovative in this area. Did you want to add any comments about this question?
Yeah, just going back to one piece of a project, like other projects too, we did have bilingual facilitators or bilingual community workers who were part of the project, who were trained in building the bridge between us and the community. They were men and women identified by the communities themselves. Now it's come in good for us, especially during the COVID time, where we've actually tapped into these local networks that these bilingual community educators or facilitators have. So it's not, it might not be the fancy Zoom, which is the in thing today, but they use simple things like WhatsApp, phone calls to just stay connected to women in the community whom they've established relationships with. So a lot of information is disseminated. Sometimes it's, last week I had a bilingual educator who actually spoke to me and said that women just want to speak on the phone. They just want to talk. They just want to share. And a lot of our refugee communities, like our South Sudanese communities, this isolation is creating a lot of other issues, such as memories of time they've been in camps, or memories of war where they've been stuck in a place. And also this created opportunities for these bilingual facilitators to connect them subtly and safely to caseworkers, to services that can still provide support. At times, we've noticed it's just a listening ear, and because of these established relationships, it just becomes a natural progression of support and connecting with services that continues to happen. What we've also done is we've used some of our local grassroots level contacts that we've made through the project to create resources that are in language and will be useful to the community. So some of them do access mainstream, fantastic resources that teams like SBS Radio have created, but we've also created our own resources designed by the community in consultation with the community that is disseminated faster, and there's greater acceptance. It's still a challenge, Maria, because many of them are still not able to come out of their homes, but we'll wait and see how things go. But we want the community to know that we are there. We're just a call away, a text away, a door away, if need be, to support them.
Thanks, Dipti, and those comments on the continuing and constant support that you do offer, and the line to other services as well, is so important. If we can now go to Catherine as well.
Hi, Maria. Thanks. And as Dipti has said, it's sometimes difficult with technology, but we know from speaking to our partners in prevention and also in some of our own work that people are checking in directly with community members using WhatsApp, text, even email and Zoom. And also, we're just emphasizing the message on our social media outreach and also in radio shows that our bilingual health educators have been delivering, and you can find information about those radio shows on our website. That although we acknowledge additional pressures on families and households at this time are creating extra stress, and that it's very real during COVID-19 crisis, that violence is never okay and there's no excuse for it. And we're ensuring that people know that mental health and family violence response services are still available, even if it's by phone, and that some are still open to go in person, and so keeping people up to date about what is available where.
Thank you, Catherine, and those are some really important channels to keep those that information flowing and people aware of services and help that's out there. To add to what the presenters have pointed out, we know that projects have always used social media platforms like WeChat and WhatsApp, and they've been doing things like creating digital stories. So the fact that they've used these multiple channels has given them an advantage at this time to be able to use that a lot more when we're in this pandemic period. And we also know that there are projects in the initiative, like the project at Women's Legal Service in South Australia that created a smartphone app with in-language information about services. So that work is particularly relevant at this time as well.